we have a very special guest in studio, and we have Dr. Carolyn Griffin, and she has, I'm going to read the little bio that I have here, if that's okay.
Of course.
Okay. How are you, by the way?
I'm great. Thanks for having me.
Good. We have a little bio here. You've been practicing chiropractic for over 20 years, and you have been voted best chiropractor in the Santa Clarita Valley for several years, and most recently was voted favorite chiropractor by the readers of the Daily News. So I got to ask you this: how did you get into chiropractic stuff? Because I feel like there's two veins that people they do medical or they do chiropractic. What was your background? What did you decide? How did you decide to be a chiropractor?
You're right. People do pick one or the other typically, and I grew up in the medical model. My dad was military, and so every 3 years, we would move. We would have to go see the doctor and, get shots and things of that nature before we can move to the next country. So that was how I grew up. And
what was your favorite place to live?
Germany.
Germany?
Yeah.
Okay.
Yeah.
Totally
Unrelated,
but go ahead. Okay.
Still relevant.
Okay.
Maybe? No. The way I got into it's quite interesting. I actually found out at the age of 17 that I wanted to become a chiropractor because at that age, I was getting ready to graduate from high school, and my dad had a double hernia operation, and he enjoyed golfing just way too much that before he fully healed, he went onto the course, took his first swing, and threw out his back, right? And so he worked at Rockwell with the B-1 bomber back up in the Antelope Valley. So they had really large parking lots. He would literally have to sit on the bumpers of cars to get to his office.
Oh.
Yeah, he was in a lot of pain, couldn't bend over, tie his shoes, anything. So a coworker of his said, why don't you go see my chiropractor? And his response was, no way, man, they're quacks.
No way. They're
right?
hippies. Yeah, that stuff. Yeah.
Right. And so he suffered for like 3 weeks, and the pain was not going away with his traditional way of taking medication and things. It just wasn't touching it.
It's just putting a Band-Aid on it.
Yep.
If it did help. Yeah.
At all. But it I don't even think took the edge off. And so finally he said, okay, I'll go. Who's your guy? It's not going away. And so he ended up going to this chiropractor, got the history exam, x-ray, started care, and after a while his back pain started to go away. So here I am, 17, getting ready to graduate high school, saying, I don't even really know what I want to be when I grow up. I said, what do you think? And he said, a chiropractor.
Oh, really?
It happened like that. And so we opened up the phone book, because, back then we opened up the phone book.
What is that? I don't know what that
right?
is. Yeah,
I know. You use them to swat flies. I don't know. And so we opened up the phone book, and we looked up some names, and I got on the phone and I called a couple of doctors saying, I'm thinking about becoming a chiropractor. Do you mind if I ask you a few questions? And a couple of docs said, you know what, why don't you just come on in and follow me around for the day?
When you were 17, you did
Yes.
this? Wow.
So I did. I went into these offices and I saw headaches going away without Advil, neck pain going away, my patients with back pain like my dad had, that was going away. And I was like, oh my gosh, I could do this. And December, I actually graduated from chiropractic school 20 years ago. So this past December has been 20 years. So I've been doing it for a while, and it's been an amazing ride, and I love it, and I just feel like I just got started.
Awesome stuff. We're speaking with Dr. Carolyn Griffin of Back To Health Chiropractic. You guys are over on Carl Boyer Drive.
Yeah.
And go check them out. You can go to also SantaClaritaChiro.com to learn more, SantaClaritaChiro.com. Give her a call at 510-8399. Okay, so those who are skeptical about it, what would you say to them?
Give it a try. What we tend to see in our office is people have tried everything and anything, up to the point of even going under the knife for surgery for their neck pain or back pain or whatever it tends to be, and then they come out and they still have it. So there's a thing with low back surgeries, there's a 50% fail rate. In fact, it fails so often that there is a diagnosis called failed back surgery syndrome.
Oh my gosh.
So many folks that have an issue with their back, they tend to take medications and they go to physical therapy, then nothing works and they end up going under the knife. They get the surgery and then they come out thinking they're going to be well, and it actually ends up being the same or worse. So we've had patients that have come into our office even after surgeries and have gotten better. But why wait till that point, right? So our whole thought is chiropractic first, then drugs and then surgery last. Always try the
Last
natural.
resort.
Yeah, always try chiropractic first as opposed to the other way around.
And so one thing I have noticed when I have gotten chiropractic care is you need to be patient with it too, right?
Correct.
It's not something where you go in and you're going to be fixed, right?
Yeah, healing takes time, just like with anything. If you've ever sprained an ankle, you know that the soft tissue injury, there's a lot of damage that's done to the joint, and it's going to take time. When we're realigning your spine, you have to realize you've had the problem for a really long time, and your body just hasn't moved structurally properly in a really long time, if ever, for some folks. And so it's a process. It's not like you're popping an Advil or a Vicodin or whatever the drug may be, and all of a sudden the symptoms are gone, but the problem still exists. And then when those medications no longer work, now you're stuck. Now the cycle your spine has degenerated as the years have gone by, and your condition ends up worsening. And now that simple Advil that you would take once a week or every so often is now, upgraded to a Vicodin. It's now upgraded to OxyContin or whatever it is, and now you're taking it every day, and that's not a pretty lifestyle. And every drug you take has a side effect. It's going to affect your liver and kidneys, and your overall health and well-being is not going to be quality at all.
Dr. Carolyn Griffin of Back To Health Chiropractic, and go to SantaClaritaChiro.com for more information. You're going to be out at the Home and Garden Show, right?
We are going to be at the Home and Garden Show. We've done it before. We're really excited to join you guys.
Fantastic. So make sure you stop by April 16th and 17th. Thanks again for coming. One more question.
Sure.
What tiny bit of advice could you give somebody to maybe one little change they could make to make sure that they are in good health?
One little change, give our office a call and let's get a checkup.
There it is.
Exactly.
All right. Give them a call, 510-8399, or again, go to Santa Clarita.
And may I say one thing?
Yeah, go,
The
please.
phone number is actually 250-1517.
Oh, good thing you said that. Yeah. What was it again? Say it one more time.
250-1517.
Okay, awesome. Awesome stuff. All right, AM 1220 KHTS. Thanks, Doc. Appreciate
Thank
you
you.
coming by.